Well, I often tell people that the whole concept of Wellwood is that somehow you reach into your own pain and loss and experiences, and you can transform that into something beautiful by giving it to someone else to help them through the cancer journey. I can't really explain what it is that drives our volunteers to do what they do, but what they do is remarkable. What clients tell us over and over is that the diagnosis of cancer is transformative in every way, so that life before the diagnosis and life after the diagnosis are two very different things. And many people tell us that there is a beauty in the transformation, almost like the caterpillar to the chrysalis to the butterfly, that there is so much that they learn on the cancer journey, there is so much that they share, there are so many gifts, there are so many silver linings in the clouds, that the person who emerges after a journey with cancer is not the person who started that journey or who embarked on the path.
What people are starting to talk about this concept of cancer survivorship, and in fact people have started to talk about cancer thrivership, where the incident of cancer has actually made people or had people go through a very difficult episode in their lives, and when they overcome it, they reflect back that in fact it's changed the trajectory of their lives in a positive way.
So I do think having a positive attitude is something that's important. I always encourage my patients by saying, look, we have to be on the same team here. I'm going to work hard to fight this cancer, but you have to help me by being positive about it and getting through, and we'll do this together. So yes, I'm convinced in myself. I can't produce the scientific evidence, but I can certainly say from many experiences with patients that attitude really helps people get through a confrontation with cancer.
I have to work within a medical system. I have boundaries and rules and guidelines that I have to follow, as does Wellwood, but they can be much more flexible in the work that they offer to patients and in what they can offer to patients.
So physicians and nurses in healthcare hospitals settings particularly will find themselves not having the time to hear somebody express their concerns, even though they may desperately wish to do so. It's not in the remit of their day's business because someone else is in a much more acute need. This is a need that others, like Wellwood staff, volunteers, community health systems, can in fact do better because they have the time, because they have the preparation and the understanding.
People often see a volunteer-run organization as vulnerable, and I see it as a real strength because people are committing they're not committing for financial gain, they're committing for personal growth, community growth, and client growth. And I just think that's much more powerful and much stronger than money.
Each instructor has a gift, and they pass it on to you. Voluntarily, and even when you say thank you, almost embarrassingly, they say, oh, well, it really isn't anything. I can assure you, with respect to conventional medicine, their healing power I have felt that has supported me and taken me along this journey more than I really could have ever expected. I'll always be grateful.
All of our services are free of charge to everyone who's affected by cancer. It's very important to Wellwood that we be accessible to everybody and that we can throw open the doors and everyone can come in and get the services that they need.
Well, we're a group of volunteers. Most of us are cancer survivors or connected closely with cancer. We meet on a semi-regular basis to share our experiences with each other and try to help bring forth information, support, and just be there and be listeners.
There is so much fear and so much uncertainty that it's very hard to see that things can be better, and it's working through that, and working through that with someone that's been on that journey, I think makes it easier.
To come to Wellwood, then you get to experience a little bit more of who you are, that you're not just this diagnosis. They say you're not your biology. And so just going beyond the biology to really who you are, brings a state of wellness. And so Wellwood, it's all about wellness.
We live in a community that is diverse in the whole sense of the word, age, gender, ancestry, faith, etc. So any program to be of value to the community, to those that need that program, has to be inclusive, and Wellwood Resource Centre has really embraced that as part of their philosophy.
Well, you know, Wellwood is an amazing model in barrier-free design, both the design perspective and the people perspective. So I wouldn't really be looking at a whole lot of barriers at Wellwood. I am so very impressed by them.
I came myself and I felt very comfortable, and I realized that this was a very safe space, that they've done a lot of work internally to make this a safe place for everyone to be.
They're all for free, a gift from Wellwood, and each one has some information about Wellwood, and also a little insert that says, "This Afghan was made for you by volunteers at Wellwood Resource Centre. Many hands have worked together to create this gift. It comes with warm thoughts and best wishes."
My mom was just tickled pink. She couldn't believe that somebody would just give these to her, and she relished them. She really relished them, and it was an important part for her because it wasn't just blanket, it was support and love.
We think to really have a meaningful role in a community, you need to be part of the community. And so limiting ourselves to any one space really wouldn't be in keeping with what we're trying to achieve at Wellwood. By offering programs and services at the hospital where people might need us, or in the community where people might be able to come to a house like this and experience a really safe, beautiful space. Those are two wonderful ways to support our clients. But at the same time, there may be other communities that aren't comfortable coming into those places, and so we go to them. We've done this so that Wellwood is always sustainable, so that our programs can be delivered at any time based on any need to any community. Wellwood's also sustainable because volunteers deliver all of our programs. It's an incredibly cost-effective model, and our donors know that when they donate to Wellwood, it is an incredible thing to be able to do so much with such a small budget. And we do that because volunteers deliver everything that we do.
So having a partner in Wellwood to help fill out address some of those needs that we don't have the capacity for is just a super resource for our community.
I think that Wellwood lets people know with cancer or families that are going through that people have cancer, that they always have someone to lean on and they can talk to people about it. And cancer changes aspects of your life, and Wellwood lets you know things that you can't understand and helps you.
Some of the uniqueness of Wellwood is because of the uniqueness of Hamilton. There are models of other centers that do supportive cancer care that exist in other communities, and they work for those communities. What we've developed at Wellwood is a model that works for Hamilton. Hamilton is a very diverse community. It's diverse socioeconomically, it's diverse culturally, and what we've created is something that's sustainable for Hamilton, regardless of the economic situation.